Hi, I'm Brian Floyd, President of Vidant Medical Center. I'm privileged to be with you today for another of a series of conversations that we're having with leaders who are shaping the future of this medical center and the care we provide to Eastern North Carolina. Today I'm with Todd Hickey, Senior Vice President, in charge of many of our service lines, including our cancer care delivery system. We're going to speak with him about the new cancer project underway here at Vidant Medical Center and how it will change the way we care for patients across the East. Well, Todd, thanks for joining us today. I look forward to the conversation that you and I will have and others get to hear about this wonderful project, our new cancer center. So why don't you start and just tell us a little bit about why this project is going to make such a difference in North Carolina?
Well, Brian, the cancer center that we are building here on the campus of Vidant Medical Center is going to be one of the premier cancer facilities in the country. Within that facility, we are going to have 420,000 square feet of new cancer space. And what's going to be great about it is that it's going to have all of our inpatient units, both in medical oncology and surgical oncology, as well as the outpatient. So that means that all of our physicians, regardless of specialty, taking care of cancer patients, will be in one facility to better serve our patients.
And the clinics too for ambulatory care?
It will be.
All here?
It will be. And it will be an inclusive model. So if you are an oncologist and you want to practice in this facility, we will work with you to be part of the team of cancer specialists that provide care here in Greenville.
If I live out in the region, how does that apply to me here? How does the continuum work?
So now with this coordination of care, we can find those patients that can most have the benefit of that technology throughout each of our local sites, throughout each physician practice that exists in every location that we provide cancer care in East North Carolina. We can now coordinate and find those patients to get them the use of that technology to cure their cancer.
So really we know cancer patients don't want to go all over looking for the different parts of their care. They really want to experience it in one place. This will do that for everybody that needs cancer care in Eastern North Carolina, but the project's bigger than just what happens in Greenville. So talk about how it works in the context of Vidant's entire approach to cancer care for Eastern North Carolina.
The secret to better cancer care through Vidant Health is always going to be the early detection, and that's where Eastern North Carolina struggles. We have way too many stage 3 and stage 4 cancer patients introducing into cancer. So now we want to improve and increase the level of access we have. We have medical home models throughout Eastern North Carolina, and we provide cancer care at 6 different locations. That allows patients to have earlier detection, earlier implementation of their treatment plan, and a much higher success rate for a cure.
So it's not about moving everything to Greenville. It's about coordinating it from here, offering some of the higher end technology here if needed, but really the whole plan for the patient happens as close to home as possible.
It does. It's delivered as close to home as possible. The idea is that you don't have to come to Greenville. It's the fact that you don't need to go any further than Greenville to receive the care that you need.
One of the things that's so important is that patients are empowered to be part of the process. Talk about how, with this new cancer team, the multidisciplinary tumor boards and things like that, how does the patient get involved in the process of determining their own care?
For some patients, it's a cure. For every patient it can be, it's a cure. But for others, it's a quality of life issue. And the patient helps make that decision. And once that decision is made, every effort is made to coordinate and provide that treatment plan to the patient that meets those patients' goals.
Todd, this project means an awful lot, not only to Vidant Health, but it means a lot to the people of Eastern North Carolina. This is our next big investment in the health status of Eastern North Carolina. I'm glad you're here to lead this project. I know you will lead our physicians together in a way that brings the best resources to Greenville and to Eastern North Carolina project. I look forward to seeing the great things that are ahead for us.
Thank you, Brian.